ER Chief Choi demands absolute military precision in the emergency department. When a COVID-19 patient enters cardiac arrest, the tension peaks. Inside the isolation room, a resident prepares to start chest compressions. Choi intervenes immediately over the intercom. He cites the strict hospital protocol. CPR aerosolizes the virus, placing the entire medical team at lethal risk. He issues a cold, final order: no compressions. The medical team stands back, restricted by the glass barrier. They use the defibrillator paddles, but without manual pressure to circulate oxygen, the heart remains still. Choi watches the monitor go flat from the hallway. The patient is pronounced dead. Choi has protected his staff from infection, but he has watched a man die without a physical struggle. Hours later, Choi appears in Dr. Charles's office with a bandaged hand. He admits the truth. He wanted to pound on the patient's chest and break every rule to save him. He followed the mission, but the silence of the death room haunts him. Dr. Charles identifies the root of the trauma. He explains that Choi's need for a perfectly functioning ER is an obsession with control that no human can maintain during a pandemic. Choi sits on the floor, stripped of his authority. He recites the Serenity Prayer, focusing on the wisdom to know the difference between what he can and cannot change. He finally accepts the most difficult fact of his career. He is a mortal man, working within the limits of a catastrophe. The rules saved the living, but they could not save the dead. Dr. Wheeler walks to the edge of the hospital roof and jumps. His body hits the pavement in front of the colleagues he worked with every day. The man who spent his career resuscitating others is dead on arrival. The emergency room continues to function, but the air is heavy with silent, collective failure. Dr. Reese sits at her station, unable to focus. She remembers Wheeler approaching her twice in the weeks leading up to this. He asked about prescriptions. He asked about therapy. Reese was preoccupied with her own rounds and dismissed him with professional platitudes. She now realizes those weren't casual questions. They were cries for help. She tells her superior that she didn't even see him drowning until he was gone. Wheeler's father arrives to collect his son's lab coat. He meets Maggie in the locker room and shares a detail no one knew. Wheeler used to spend his breaks in the pediatric oncology ward performing magic tricks. He pulled lemons from children's ears and cards from thin air, giving dying kids 10 minutes of joy. He was a man who provided light to the hopeless, but kept none for himself. Dr. Charles watches the staff struggle to maintain their composure. He states the facts plainly. Physicians have one of the highest suicide rates of any profession. They are trained to be invincible, forced to ignore their own trauma to treat the trauma of others. They play a high-stakes game where the odds are permanently stacked against them. The hospital monitors continue to beep. The staff saves a heart attack patient in room 4, while their colleague is moved to the morgue. They are the savers who could not save their own. 13-year-old Allison is rushed into the emergency room suffering from acute abdominal pain and severe mental confusion. Her condition escalates into a violent seizure. Doctors are forced to paralyze and intubate her to stabilize her breathing. A high-precision PCR test is ordered to scan for viral pathogens. The results return a positive match for HSV-2, the virus responsible for genital herpes. The medical team faces a grim reality. A child has been sexually violated. Police immediately isolate the stepfather for questioning, but the investigation takes a sharp turn when toxicology reports arrive. Allison's blood contains trace amounts of triazolam, a potent sedative with amnesic properties. This chemical is not found in standard pediatric treatments. Dr. Manning identifies a critical fact. Allison recently had braces installed. While triazolam is used for dental anxiety, the dosage in her system suggests a deliberate intent to incapacitate. The evidence points toward the dental office. The dentist utilized the clinical setting and heavy sedation to assault the girl, relying on the drug to wipe her memory of the event. When the tube is finally removed, Allison wakes up. She remembers nothing of the pain or the violation. She smiles at her mother and asks if she can still attend the junior high school dance. She is excited about her new braces, unaware they were the gateway to her nightmare. The doctors watch her in silence, knowing the police are already at the clinic, while the girl remains trapped in a stolen innocence. Dr. Becker selects a TAVR procedure for an intermediate risk patient. She chooses a minimally invasive valve replacement to avoid opening the chest. Dr. Rhodes warns of potential complications, but Becker moves forward. Inside the operating room, the team positions the new valve and injects dye. The left coronary artery is clear, but the right side shows zero flow. A calcified deposit from the old valve has broken loose, completely occluding the artery. The heart begins to die. It balloons under the pressure of acute failure. ST changes flash across the monitor. The heart stops beating. Rhodes takes immediate control of the surgery. He orders the chest to be opened, abandoning the minimally invasive plan. He works through the blood to perform an emergency bypass. The right heart continues to distend. Rhodes demands a milrinone loading dose and an epinephrine bolus. Becker insists on ECMO, arguing that the heart is too weak to recover. Rhodes ignores the suggestion and prepares for internal defibrillation. He places the paddles directly onto the heart muscle. One shock. The room falls silent as the team watches the monitor. A steady rhythm appears. The septum returns to the midline and blood pressure stabilizes. Rhodes proceeds with decannulation. The heart is beating on its own. He has corrected a fatal error with surgical precision. Becker stands back, her original plan a failure, as Rhodes secures the patient's life. FBI agent Sam Pearson arrives at the emergency room following a reported motor vehicle collision. Dr. Will Halstead notes the deployment of the airbag, but finds the internal damage inconsistent with a low-speed crash. Sam cannot protect his airway. Will intubates him and orders a chest x-ray. The images reveal multiple rib fractures and bilateral pulmonary contusions. The patient's oxygen levels continue to drop despite maximum ventilator support. Will examines the bruises on Sam's legs. They are too extensive for an airbag injury. He reviews the CT scan, which shows a total pulmonary whiteout and a subcapsular liver hematoma. These are the signature markers of a blast injury. Will confronts Sam's partner, Ingrid, demanding the truth. Ingrid admits the real cause. A raid on a meth lab ended in an explosion. The suspect ignited red phosphorus and acetone peroxide. Sam's vitals crash. His blood pressure falls to 92/56. His heart rate drops to 48. Air leaks from his lungs into the chest cavity, creating a bilateral tension pneumothorax. The internal pressure prevents his lungs from inflating. Will performs an emergency needle decompression, driving catheters into Sam's chest to release the trapped air. He transfers Sam to the ICU to be placed on ECMO, a machine that will bypass his destroyed lungs to keep him alive. Later, Ingrid describes the scene of the blast. The suspect's 6-year-old daughter was inside. Amidst the wreckage, Ingrid found a pink unicorn toy. It was perfectly intact. She breaks down the technical survival of her partner, overshadowed by the total devastation of the explosion. Denise enters the hospital with a bleeding lip and a swollen face. Maggie, the head nurse, sees the injuries and immediately identifies the source. Denise refuses medical help and defends her boyfriend, Trevor. She insists the violence was her fault and claims Trevor is the only person who truly loves her. Maggie realizes logic will not break this cycle of manipulation. She leaves the hospital and drives to the car lot where Trevor works. Maggie confronts Trevor in public. She stands her ground as he tries to charm his way out of the situation. She informs him that any further contact with Denise will result in an immediate police report. Trevor drops the act and calls Denise a drama queen. He shows no remorse, only irritation that his prey is being protected. Maggie stares him down until he backs away. He is a predator who fears consequences more than he values Denise. Maggie returns to the hospital room. She looks at her sister and delivers a calculated lie. She tells Denise that Trevor fled the moment he was confronted. She claims he admitted he never loved her and left without looking back. Denise breaks down, screaming that Maggie has destroyed her only relationship. She tells Maggie she hates her. Maggie remains silent and accepts the resentment. She has traded her sister's affection for her sister's life. The toxic connection is severed through a brutal, necessary deception. 14-year-old Matt Jacobson arrives at the emergency room with a shattered left forearm. Dr. Connor Rhodes examines the injury and immediately disputes the cause. The fracture pattern does not match a fall from a skateboard. Rhodes smells alcohol on the father's breath and notes his visible agitation. He concludes this is a case of domestic battery used to harvest opioids. Rhodes orders a social work evaluation and prepares to involve Child Protective Services to isolate the boy from his father. He confronts the man in a private room, accusing him of abusing his son and stealing his medication. The situation shifts when the toxicology report returns. Matt's system is completely clean. He has not ingested any of the hydrocodone prescribed to him. Rhodes enters the hospital room to finalize the report to the authorities, but Matt interrupts. The boy admits he slammed his own arm in a heavy door on purpose. He did it to secure a prescription for his father. A car wreck 10 years ago left the man with chronic back pain, but recent CDC guidelines abruptly cut off his legal access to oxycodone. Without a prescription, the father turned to alcohol to manage the withdrawal and the pain. Matt watched his father suffer and decided to trade his own physical safety for his father's relief. The accusations of abuse collapse into a reality of desperation. Rhodes realizes he misidentified a sacrifice as a crime. He cancels the call to child services and provides a referral to a specialist. The case ends not with an arrest, but with a doctor standing in the silence of his own error. Desiree collapses at the hospital entrance as a violent seizure takes hold. A CT scan confirms the worst. Her ovarian cancer has metastasized to her brain. A large tumor sits on her right temporal lobe. Doctors recommend an immediate craniotomy, but Desiree refuses. She is pregnant with a son named Elijah. She knows general anesthesia risks the baby's life, and she chooses his safety over her own. Her condition spirals. A second seizure strikes, her right pupil dilates, and brain swelling begins. She is intubated and placed on a ventilator. Caleb, her husband and legal surrogate, panics and demands the surgery. He cannot face losing her. Doctor Charles presents a cold ultimatum. Without the operation, Desiree will never wake up. The alternative is to use steroids to manage the brain swelling, keeping her body alive on life support just long enough to reach a viable delivery date. Caleb realizes this would turn his wife into a human incubator. He struggles with the weight of the decision, recalling their years together since college. He sees the machines breathing for her and the doctors waiting to wheel her to the operating room. In the final moment, Caleb stops the team. He withdraws his consent for the surgery. He chooses to respect Desiree's original wish and her maternal sacrifice. He lets go of the woman he loves to protect the son she died to save. A lethal strain of necrotizing fasciitis hits Chicago, leaving victims with dissolved flesh and failing organs. The infection acts with surgical precision, targeting specific locations across the city. Detective Haley Upton analyzes the digital evidence and discovers the primary suspect's IP address was spoofed. This is not a random outbreak. It is a calculated bioterrorist attack. Dr. Selden, a lead microbiologist, embeds himself within the police command center. He offers expertise, analyzes samples, and directs the search for a cure. He stands before the investigators, pointing at whiteboards and explaining the bacteria's behavior while secretly steering the investigation away from the truth. The breakthrough comes from a rental agency. Detectives track a blue pickup truck linked to the crime scenes through the lead's database. They retrieve surveillance footage via Dropbox. The video shows a man in a blue hat paying cash for the vehicle. When the man looks directly into the lens, the team recognizes the face. Their lead consultant, Dr. Selden, is the man who sowed the infection. Selden senses the shift in the room and retreats to his laboratory. He works quickly to eliminate the evidence of his work. He pulls bacterial cultures from the incubator and begins dousing the petri dishes with corrosive chemicals. Steam rises from the samples as the evidence dissolves. A detective confronts him mid-action. Selden claims the samples were contaminated and required immediate disposal. He maintains his professional composure until the handcuffs click. The man tasked with stopping the death was the one manufacturing it. Natalie is rushed into the trauma unit following a violent car collision. She is unconscious, and her vitals are unstable. Doctors immediately transport her for a CT scan to evaluate severe head trauma. While Natalie is incapacitated, Philip enters the hospital. He intercepts the medical team and identifies himself as her fiancé. He establishes this false authority before Natalie can regain consciousness. When Natalie finally wakes up, her memory is a blank. The neurosurgeon confirms a traumatic brain injury and significant short-term memory loss. She cannot recall the crash or the events leading up to it. Philip seizes this void. He sits by her bed, holds her hand, and produces a diamond ring. He tells her they are engaged. He claims he proposed just before the accident and that she accepted. Natalie stares at the ring on her finger, her mind unable to find the missing pieces of her life. She accepts his story because her brain cannot produce a contradiction. Will, the man who was actually with her, stands in the doorway. He is covered in his own blood and sidelined by hospital protocol. He watches Philip rewrite Natalie's history in real time. Philip stares back at Will, using the lie to physically and legally bar him from the bedside. Natalie's confusion turns into a forced acceptance of a stranger's narrative. The deception is finalized, anchored by a ring Natalie does not remember and a memory Philip has successfully stolen. Young Thomas sits in a hospital bed, complaining of a persistent headache. Dr. Choi holds up a finger and moves it across the boy's field of vision. Thomas cannot follow the movement. He has lost his peripheral vision. An MRI scan reveals a mass near his pituitary gland. The surgical team identifies it as a craniopharyngioma, a tumor pressing directly against his optic nerves. They schedule immediate brain surgery. The surgeons state that if they do not operate now, the boy will go permanently blind. As the team prepares for the procedure, Dr. Choi notices physical details the specialists ignored. Thomas is significantly smaller than other children his age. His pulse is abnormally slow, and his physical reactions are sluggish. Choi stops the lead neurosurgeon in the hallway. He argues that the mass might not be a tumor, but a symptom of an endocrine disorder. The neurosurgeon is dismissive. He warns Choi that if they delay the surgery and the theory is wrong, Thomas will end up blind or comatose. Choi stands his ground and demands a blood panel before the first incision is made. The results confirm his suspicion. Thomas is severely hypothyroid. The mass on the scan is not a tumor. It is hyperplasia, a compensatory enlargement of the gland. There is no need for a craniotomy. Choi informs the parents that medication will shrink the mass and restore their son's vision. The surgery is canceled. Thomas avoids a high-risk brain operation because a single doctor prioritized clinical observation over a preliminary diagnosis. Dennis stands at the quarantine line, telling responders he passed his EMT test and starts at the fire academy next month. He is physically fit and eager to help. He wants to be a rescuer. Soon, the roles reverse. Dennis is rushed into the hospital with a rapidly spreading infection. Flesh-eating bacteria have entered his system through a minor wound. In the emergency room, Dr. Marcel examines the arm. He finds total muscle necrosis. The tissue is black and unresponsive. There is no blood flow left to save. The infection has reached the bone. In the operating room, surgeons cut through layers of fat and soft tissue, but they cannot get ahead of the rot. The surgeon stops the debridement and calls for a bone saw. He removes the limb to stop the bacteria from reaching the heart. Dennis wakes up in the recovery ward. He looks at the stump where his right arm used to be. He asks the doctor what his life looks like now. The fire academy requires 2 hands. His dream of saving others ended in an isolation room. He is no longer a trainee. He is a man facing a permanent disability. The transition from peak physical health to amputation took less than 24 hours. He is alive, but the future he built is gone. Amanda sits behind a heavy plastic barrier in the quarantine zone. Haley speaks to the 15-year-old girl, attempting to bridge the gap created by the isolation ward. They form a fragile bond, but the medical reality outside the room is shifting. Inside the laboratory, a monitor displays the E87 superbug. The bacteria do not follow natural growth patterns. They divide and multiply at a violent speed, colonizing the petri dish before the researchers can react. The team applies vancomycin, the medical world's last line of defense. The data confirms a catastrophe. The antibiotic only inhibits the bacteria without killing them. The superbug is resistant to the strongest treatment available. Amanda is moved into a CT scanner for further evaluation. Mid-scan, she erupts in a scream of pure agony. She describes a sensation of something crawling and shifting deep inside her leg. The imaging technician freezes as the results appear on the screen. Air and fluid have already infiltrated the deep fascia. The infection is aggressive and moving faster than the surgical team anticipated. The bacteria are literally consuming her tissue. The lead doctors initiate a high-stakes protocol. They decide to hit the infection with a massive, lethal dose of gentamicin, pushing the drug to its toxic limit. It is a final, desperate attempt to overwhelm the mutation before it reaches Amanda's bloodstream. The medical team surges into the hallway, pushing the gurney toward the operating theater. There is no margin for error. They are racing against a biological clock that is rapidly running out. A couple is rushed to the emergency room after a severe car crash. The husband is hemorrhaging, and doctors initiate a massive transfusion protocol to stabilize him. While treating the wife, Dr. Manning discovers old, yellowing bruises across her lower back. These injuries indicate long-term domestic abuse. The husband's right leg is mangled beyond repair, the dying muscle is poisoning his blood, and he requires an immediate amputation to prevent renal failure. When the surgeon asks the wife for consent, she hesitates. She tells the doctors she wants to wait for her husband to wake up and decide for himself. Every minute she delays, his internal organs deteriorate. Dr. Manning suspects the wife is intentionally stalling and takes the matter to the ethics committee. The committee decides the wife is unfit to make medical decisions due to her status as a victim and strips her of her rights. They order the surgery to proceed immediately. However, the delay has lasted too long. The husband dies of multi-organ failure before the procedure can begin. In the aftermath, the wife reveals she was the driver. She intentionally drove through a red light at high speed. She used the crash and the subsequent medical bureaucracy to ensure her husband would not survive. She risked her own life to facilitate his death. The accident was a planned escape. She used the hospital's own rules to finish what the collision started. Nina and Harlan enter the emergency room. A red rash covers Nina's neck and arms. They are newlyweds, only 1 month into their marriage. While left alone behind the hospital curtain, the couple begins to kiss and engage in sexual intimacy. Minutes later, Harlan's screams for help pierce the hallway. Nina is unconscious on the gurney. Her airway has collapsed. Dr. Choi arrives to find Nina in full anaphylactic shock. Her heart rate plunges into the 40s as her blood pressure bottoms out. The medical team forces a tube down her throat to breathe for her. They push epinephrine and intravenous fluids. Nina is stabilized, but the source of the reaction remains unknown. Dr. Choi notices the timing of the attack. The respiratory failure occurred immediately after the couple was left alone. He confronts Harlan and asks if they had sex in the treatment room. Harlan admits they did. Choi orders an immediate laboratory analysis of Harlan's semen. The system results confirm a rare biological mismatch. Nina suffers from human seminal plasma hypersensitivity. She is severely allergic to her husband. Every act of unprotected intimacy is a potential death sentence. The diagnosis leaves the newlyweds stunned. Their plan to start a family is now a medical hazard. To prevent another life-threatening shock, they must return to using condoms. For a permanent solution, Nina faces a grueling desensitization process under a fertility specialist. Their marriage continues, but the physical connection now requires an EpiPen on the nightstand. Augie Roberts is 10 years old and dying of liver failure. He requires a TIPS procedure to reduce portal hypertension, but the Department of Children and Family Services rejects the medical order. The state social worker cites a protocol requiring 2 failed alternative treatments before surgery is approved. The doctors argue that the boy does not have time, but the state remains his legal guardian. The bureaucracy blocks the surgery. The situation turns critical in seconds. Augie starts coughing and then begins vomiting blood. His esophageal varices have ruptured. Blood coats the bed and the medical staff. His blood pressure drops. Dr. Manning and the team move in to perform an emergency intubation. They must secure his airway before he suffocates. Under the law, an immediate threat to life removes the requirement for state consent. The doctors use this fact to bypass the DCFS denial. They wheel Augie into the operating room for the TIPS procedure while the social worker watches from the hallway. Augie survives the surgery, but his placement fails. The couple who plan to adopt him sees the severity of his condition and withdraws their application. They tell the social worker he is too much to handle and leave the hospital. Augie is once again a ward of the state with no home. Maggie Lockwood stands outside his room and looks at her husband. They make a decision. They inform the administration that they will foster Augie. They sign the documents, ending the boy's status as an orphan and taking legal responsibility for his care. Zach arrives at the emergency room after falling from an overpass and crashing through a car's windshield. Dr. Choi performs a full-body scan to locate internal bleeding. While Zach lies broken on the table, his father immediately controls the narrative, insisting the fall was a freak accident. He refuses any suggestion of a suicide attempt, prioritizing family reputation over his son's mental state. Dr. Choi examines the physical evidence and suspects the truth. He attempts to place Zach on a psychiatric hold, but without proof of intent, the father successfully blocks the intervention. The only witness is the driver of the car, currently sedated and on a ventilator in the ICU. The attending surgeon, Dr. Marcel, refuses to wake her, stating that decreasing her sedation could trigger a metabolic crisis. Choi ignores the medical protocol. He enters the ICU and manually adjusts the ventilator and medication levels to force the patient into consciousness. As the woman struggles against the tube in her throat, Choi asks her for a signal. He presents a binary choice: did the boy fall or did he jump? The driver blinks to confirm the boy jumped. The accident is exposed as a lie. Choi confronts the parents with the witness testimony, stripping away the father's excuses. The boy is finally transferred to the psychiatric ward for the help he needs. Choi has secured the truth, but he has done so by violating hospital policy and risking a stable patient's life. The family's facade is gone, replaced by the cold reality of their son's despair. Aisha Barnes arrives at the emergency room from Cook County Jail. She is 37 weeks pregnant and shackled to the gurney. Dr. Natalie Manning asks for the cuffs to be removed, but the guard refuses, citing Aisha's status as a violent offender. Aisha reveals she has been suffering from severe headaches for a week, but jail staff ignored her complaints. Her blood pressure spikes to 162 over 110. Suddenly, Aisha's body stiffens into a violent seizure. Natalie diagnoses eclampsia and orders an emergency C-section. The surgery is successful. In the recovery room, Aisha holds her newborn daughter. The guard enters with metal shackles. He cites a shift change protocol. Because he is now the only officer present, the inmate must be restrained and the infant removed to the nursery. Aisha begs to keep her child. Natalie stands in the doorway, physically blocking the guard's path. She tells him the baby is staying. The guard demands she step aside and moves to seize the child. Natalie does not flinch. When the guard tries to force his way past, Natalie shoves him hard against the wall. She maintains her position until hospital security arrives and places her in handcuffs. Following a tense negotiation between the hospital board and the sheriff's department, the police agree not to press charges. Natalie is released. Because of her intervention, Aisha is granted several days of unshackled recovery, allowing her to nurse her daughter before returning to her cell. Natalie stands in the corridor, watching the mother and child through the glass. Yesenia's lungs stop functioning on their own. A ventilator now forces oxygen into her chest, but the machine cannot provide a reason to live. April observes the girl's fading vitals and realizes Yesenia has surrendered. She approaches Doctor Ethan Choi with a single plea: allow Yesenia's mother into the isolation ward for a final goodbye. Ethan refuses. He points to the hospital's rigid COVID-19 protocols. PPE is in short supply, and the risk of cross-contamination is too high. To him, the rules are absolute. He views the situation through the lens of logistics and safety, while April sees a girl dying of isolation. The request is denied. While Yesenia struggles in her sterile bubble, her mother, Alejandra, is working at a hotel. She takes extra shifts to pay for the mounting medical bills. The virus strikes. Alejandra collapses on the pavement, her lungs seized by the same infection. An emergency team rushes a new patient into the COVID unit. It is Alejandra. She is unconscious and requires immediate intubation. The nurses wheel her bed into the ward and position it directly across from Yesenia. The two women are now reunited, separated only by a hallway and 2 panes of glass. Both are hooked to identical machines. The rhythmic hiss of the ventilators is the only sound they share. They are inches apart, yet the hospital regulations remain an impenetrable wall. Mother and daughter face the end of their lives in parallel, staring at each other through the transparent barriers of a system that kept them apart until it was too late. Dr. Charles's ex-wife arrives at the emergency room with severe abdominal pain. Dr. Crockett uses an endoscope to examine her stomach lining, discovering a perforated ulcer caused by the chronic overuse of painkillers. As she is prepped for surgery, Charles sits with his daughter Anna in a tense waiting area. Anna confesses that she hacked into her mother's laptop. She found dozens of emails from a real estate agent in Phoenix detailing a secret plan to move across the country. Anna does not want to leave Chicago. After the operation, Charles visits the recovery room. He informs his ex-wife that her recovery requires at least 8 weeks of restricted movement. He presents this as a medical necessity, but his true intent is to stall the relocation. His ex-wife immediately recognizes the manipulation. She tells him that the move to Arizona is a career opportunity she will not abandon. The conversation turns into a sharp confrontation. Charles attempts to use his status as a doctor to dictate her timeline, but she dismisses his authority. Despite being a renowned psychiatrist capable of deconstructing any patient's trauma, Charles cannot manage his own family's collapse. He realizes that medical facts and psychological tactics are useless against her determination to leave. He stands in the hospital corridor, forced to accept that his daughter is moving thousands of miles away. The man who solves everyone else's problems is left powerless to stop his own life from splintering. Todd Lowry, a prominent plastic surgeon, is wheeled into the emergency room after losing consciousness during a self-performed surgery. He was attempting to remove a lipoma from his own abdomen when he lost a dangerous amount of blood. Even while hooked to a monitor, Lowry maintains a cold, professional detachment. He lifts his gown to reveal a torso he has meticulously sculpted over years, pectoral implants, liposuction, and an 8-pack created with fillers. He explains that he operates on himself because he refuses to settle for anything less than perfection, and he trusts no other surgeon's hands. The situation turns violent when Lowry begins critiquing the ER team's work. He notices a perceived flaw in his abdominal closure and demands to fix it. Before the nurses can intervene, Lowry rips off his bandages and begins digging into his own open, bleeding wound with his bare hands. He ignores the pain, focused entirely on closing dead space and correcting a dimple in the skin. Dr. Ethan Choi moves to apply physical restraints and orders immediate sedation to stop the self-mutilation. However, Dr. Charles, the head of psychiatry, steps in and blocks the order. Charles refuses to use force, choosing instead to confront the surgeon's pathological need for control. He forces Lowry to stop the physical struggle by addressing the mental breakdown disguised as perfectionism. Choi is left incensed by the psychiatrist's interference, but the immediate bleeding is contained. Lowry sits back, his body a map of self-inflicted scars, a man who has turned his elite medical skills into a weapon of self-destruction.